Can I just welcome the announcements made this morning by the Therapeutic Goods Administration around the approval of Pfizer booster shots 6 months after second doses for everybody aged 18 and over. That's a really important step forward. We're very keen to be getting on with that booster program. We're obviously ready to assist and to support that rollout across Victoria, and in fact across Australia. We are now eagerly awaiting ATAGI's advice and the Commonwealth's decision on how this will be done. But our clinics, our local public health teams, all of our vaccinators are standing ready to get on with that program. Of course, the vast majority of people are well under the 6 month since their second dose, so this is not an immediate thing for the vast majority of us. But there are 69,000 Victorians currently today that we're aware of where it's been more than 6 months since their second dose, primarily residents of aged care and healthcare workers. So we'll be very keen to move on with the booster program as soon as we get the green light from ATAGI and the Commonwealth. I'm also really pleased to announce, or pleased to see the news from Coles and Woolworths around their planned deployment or planned sale of rapid antigen tests from the 1st of November, from next week. We've been using rapid antigen tests within our testing systems now for a number of months, certainly within some of our hospital emergency departments, also for some of our hospital visitors, including the children's. We're doing a trial at the moment with a small number of schools, and of course we've used it in some of our major construction projects. I'm also aware that many organisations, particularly larger organisations, are using rapid antigen testing as part of a screening tool for their own workforces and have been doing that with good effect for some time, including of course some of our distribution centres. So we're very, very pleased to see this development. It will provide, along with the clearance for people to use rapid antigen tests at home, so without clinical supervision. That's also possible from the 1st of November, and it becomes another good tool in our armoury for all of us to have as a way to deal with the risk of COVID in our community. Of course, they complement, they're an additional measure. So anybody who is using a rapid antigen test, it's a great screening tool. It's great to use on a regular basis to see if you're becoming positive. It's obviously great to use if you think you've got symptoms. But please, if they turn positive, you must get a PCR test. You need to get a PCR confirmatory test of any positive rapid antigen result. And of course, our entire network of over 200 testing centres remains available for you to do just that. So it's a good step forward. And again, it's another way for us all to manage our risks more locally, but still to be part of keeping COVID under control in our society. We've also got, of course, with our vaccination programme, we continue to push on with our school pop-ups at the moment. So we have another 6 running this weekend. So again, I'd encourage particularly communities in around Laverton College, around Craigieburn Secondary College, Doveton College, Lindale Secondary College in Dandenong, Hume Central Secondary College, and Creekside College in Caroline Springs. They'll all be running vaccination pop-ups this weekend. If you live in those areas and you haven't yet been vaccinated, or if you live in those areas and you want to get your second dose, then please come forward and get them done there. Or of course, any of the other state clinics or the literally hundreds, no thousands of pharmacists and GPs around the state that will continue to help you get vaccinated over the days and weeks ahead. And again, it's sobering to see that of the cases we reported yesterday, 85% of those people were not fully vaccinated. Of the people in ICU, 95% are not fully vaccinated. And we still have, as I said, just under 500,000 Victorians who have not yet had their first dose. And we are, if we look at our Burnett modelling of where we expect case numbers to be, although we expect case numbers to maybe ease off a bit, hopefully over the coming days, we are expecting them to rise, and they will rise amongst the unvaccinated. The cases are affecting over 2/3, or 85% in fact on yesterday's numbers, are impacting those who are not fully vaccinated. That is the group that is most at risk. And if you are one of those 500,000 people, particularly kind of call out people in their 20s, where we are seeing a lower take-up of vaccine at the moment, with only 83% of those in their 20s having had first dose, we really want to encourage you now to get vaccinated. The rest of us are not going to stop. We are going to move on. We're on track for 80%. We're on track for 90% later in November. But we do want to take everybody with us and make sure they've got the protection of the vaccine at this point in time. Finally, for those of us who are vaccinated, remember we can still catch and pass on the virus. It's just the impact on us and the impact on our health is so much less. So therefore, please keep checking yourself for symptoms. And as we start to move around more, particularly from Friday onwards, and particularly as Melburnians can start to enjoy travelling to regional Victoria again, please be aware that we will see more people with symptoms and we'll see more cases moving across our state. So if you do have symptoms, please get tested. Please get tested swiftly and isolate and monitor for any, wait until you get your test results. And if you are positive, again, help us all out, get the information out to those people you've seen recently. We're all about to go through a phase of seeing a lot more people, more social contacts, back at work, back in other settings. So please, if you are testing positive, do your bit and let people know that you've tested positive and encourage them to get a test. We, of course, continue to follow through with all of our contact tracing work. The 99% of people that we contact within 24 hours when they've tested positive, all those disciplines and processes remain in place. But what we find time and time again when we talk to people in our contact tracing interviews, they've already let their friends and family know, people that they've seen, they've let their employer know critically, so people can take the appropriate measures and protect for the onward spread of the infection.